As the world struggles to curb the COVID-19 pandemic, the Plateau State Primary Healthcare Development Agency has, in conjunction with the National Primary Healthcare Development Agency, has impressed on the need to train health personnel so as to reduce and avoid community spread. This is by ensuring that its health practitioners are well trained. Quaanpan Local government, with 63 primary health care centers, selected 2 persons from each to participate, and 2 also from private clinics to ensure that the local health system is adequately covered. Tong Mordrabis from Plateau State Primary Health Care Development Agency is a supervisor for the training.
To train them on how to prevent themselves from being contacted with the virus and how to enlighten the community so that the communities cannot be infected with the virus to prevent the transmission of the COVID-19 virus.
She called on communities to adhere to directives by government and health professionals as it is a sure way to curb the spread of the pandemic. On his part, Director of Health, Quaanpan Local Government Council, Abdullahi said, primary health care at the local level has a vital role to play in the fight against community transmission, hence the need to train personnel adequately.
We are organizing 4 days training of health workers and community health volunteer workers on response and preparedness on how we combat the COVID-19.
Some of the participants and facilitators were seen conducting the training across the classrooms of the Science Primary School, Dumak, the venue of the exercise.
The strategy should go in such a way that since this one has a smaller community, the priority should go in line with the size of the people around it.
Priority resource lists should be developed or adapted from existing lists.
It will be recalled that Professor Patrick Dakum of the Institute of Human Virology has recently advocated for the need to train and convert primary healthcare centers at the ward level to make them COVID-19 sample collection centers.
Every primary healthcare center should be a sample collection center, meaning that there is no ward that there is no primary healthcare center in Nigeria. In Plateau, there are so many primary healthcare centers. We must actively train the officers there and provide all that it takes to collect samples.
This is Rowland Longs.